I'm Dr. Phillip E. Williams, Jr. of Dallas, Texas, Chairman of the Archives Committee of the American Association of Neurological Surgeons. It's been my goal for many years now to have the opportunity to interview, visit with some of our distinguished neurosurgeons, those who've trained us, inspired us, and given us the opportunity to carry forth with the field that they pioneered. Today we're in Los Angeles, October 1981, and we have the privilege of having Dr. James Garber Galbraith, who is the honored guest for the Congress of Neurological Surgeons. We have a number of things we'd like to talk about, and I'm going to leave this to Dr. Galbraith to discuss what he thinks would be of interest to those who will be enjoying these tapes further down the line. Dr. Galbraith, tell us about your practice. Where did you start? I think you've come from a medical background. I'd like to have a little biographical history, if you will, and tell us about your medical training and any of the folks that trained you in neurological surgery.
Well, you indicated my background. It's true. My grandfather was a physician. My uncle was a physician. And I guess I came by the tendency naturally to go into medicine. I went to medical school at St. Louis University, graduated in 1938, and went down to Birmingham for my internship at the Lloyd Nolan Hospital. During that time, I was undecided about what I wanted to do. I had been very intrigued with neuroanatomy in medical school, and when I got into clinical medicine, I found the challenges of disorders of the nervous system the most intriguing aspect of medicine to me, and I think that's what guided me into the field of neurosurgery.
Wasn't it any particular operation or friend or family that had any type of neurosurgical procedure that might have influenced you?
As a high school student, one of my classmates was involved in an automobile accident, spinal cord injury and paraplegia, and I think that was my first experience with anything related to neurosurgery, and that impressed me very much.
I see. Now, you can certainly detect by Dr. Galbraith's accent, he's from the Deep South, and Alabama is his home. He has been in practice in Birmingham, where he's been chairman of the department at the University of Alabama. But tell us about your chief. You trained many folks over the years, but who trained you?
Well, I trained at the Neurological Institute in New York at Columbia Presbyterian Medical Center. Dr. Byron Stuckey was my chief surgery. Dr. Tracy Putnam was the director of the institute. So I had the great good fortune to be under the guidance of two remarkable people. Dr. Stuckey was a truly remarkable surgeon, a superb technician, absolutely honest and very demanding individual, which I quickly recognized was absolutely essential in the field of neurosurgery. Dr. Putnam was a scholar, a charming gentleman who added a great deal of if you will, luster to the romance of the nervous system.
Any particular stories that remain in your mind that you might like to share with us about either of these two individuals that perhaps we would never have an opportunity to know about?
Well, I can only say that it was a continually rewarding experience to be with both of these individuals. I think I owe the majority of my training, if you will, in neurological diagnosis and in the technique of neurosurgical procedures to Dr. Stuckey.
I understand that he did a lot of pain procedures, did he not?
Dr. Stuckey did a great many operations for trigeminal neuralgia and a good many chordotomies and the other procedures that were in vogue at that time for the control of intractable pain.
I was always told that Dr. Stuckey would never ask a patient following a ablative procedure for pain whether he had pain or not following the procedure. Is that true?
That certainly is true. It was his contention that this was suggesting to the patient that he might still have pain, and his approach was to be reassuring to the patient that he was better and that he was going to do all right.
In my experience, I found that to be very true.
Yeah.
I employed that same
Yes.
approach. What type of practice have you had, Dr. Galbraith? I know you've been in academic medicine, and of course your curriculum vitae is very impressive. You've been president of the Southern Medical Association, of course the various neurosurgical associations, the Academy, and you were chairman of the American Board of Neurological Surgery. Outside of academics, what about your private practice? Did you have private practice for a while there?
Oh, yes. I entered practice in 1946 after I came out of the Navy in Birmingham. And while I was nominally in charge of the neurosurgical program at the medical college at that time, there were, of course, no full-time clinical people. It was purely a voluntary practice. So I practiced neurosurgery in the community hospitals for a number of years. And it was a very rewarding and interesting experience, although in the course of time it came to the point where I simply could not practice in different areas and do the sort of job that was needed in the direction of a teaching program.
Was there any particular area of research that you were interested in more so than any other?
Well, I've always been interested in cerebral vascular disease, and I think that that would be the area that I was particularly interested in from the standpoint of research. And being clinically oriented, it was primarily from the standpoint of clinical investigation.
Certainly your presentations here at the Congress this year would fall in line with that. We certainly enjoyed your presentations and you being our honored guest. What would you say are the most impressive advances in neurosurgery today? Advances that you wished you had when you were just starting in practice or just been in practice 5 or 10 years?
In looking back, I think that the first big advance after I began practice was the development of angiography. We did our first angiograms in 1946 by direct needle puncture of the carotid, and sometimes we had to cut down on the artery to get to it. A single injection, a single lateral film, and that was it. And I would say the development of serial angiography was a monumental advance at that time, because that really opened up the whole field of cerebral vascular disease.
Certainly did. I guess you can remember those hand changers.
Yes, indeed. The hand changers came along even later than the time when we started out.
Looking back over the last 30 years of your active practice, 30, 40 years, what would you say are the biggest problems that we've had to face in neurosurgery, and how have we done in solving some of these problems?
Well, I think we've done a splendid job in solving some problems. Others are still very frustrating to us. I think certainly the benign tumors and the control of lumbar and cervical disc disease and the spinal stenoses, lumbar and cervical, all those areas I think have evolved very well. I think the continually frustrating areas to me are the malignant gliomas and spinal cord injury.
What would you say is your most favorite operation? Which one?
Oh, no doubt. Operation for any type of meningioma, intracranial or spinal.
Just the fact that you had a good opportunity for a cure and to really help the person. Is that
yes.
the thought behind that?
Yes, indeed. And the patients do so well, and the results are so gratifying.
What about the least favorite operation? Is that fair to ask?
Well, I would say, by the same token, the least favorite operation would be one in which the results are so often disappointing, and that would probably be operations for spinal cord decompression for metastatic carcinoma of the spine.
Is there an operation that you did that you wish you'd never done?
I don't know specifically about that. I've had some real qualms about certain operations, particularly those related to some congenital defects such as hydrocephalus and myelomeningocele with paraplegia and that sort of thing. I don't know if we really, if we've done a favor to the victim or to the family sometimes when we've done multiple procedures on patients in that category.
What about the future of neurosurgery? What are you anticipating? 10, 15 years, another 19 years we'll be in the new century. What would you expect to see around year 2000?
It's difficult to say. I can only begin by, if you will, taking a historical look at neurosurgery as to where it has been and where it is today. And as I began my practice, it was mainly that of tumors, trauma, trigeminal neuralgia. And then in the late 40s, the field of sympathectomy for hypertension came into vogue, and that kept us busy for a few years, as did the operation for prefrontal lobotomy. We did several hundred of those cases with generally very satisfactory results at the time. Those, of course, are procedures that have gone completely by the board, and a whole new series of procedures have developed. With the advent of in the last decade, the use of the microscope, we now see an anatomy that we never realized existed before, and now with the computerized tomography scan, we are having completely new dimensions from the diagnostic standpoint. I think with all the new technology, there's just no way to tell exactly where we're going except to say that there are going to be some very exciting and dramatic changes. The knowledge about the endorphins and enkephalins and the study of the mechanisms of pain, I think, are going to be developed to the point of effective measures for control of intractable pain. I think that will probably be one of the biggest advances.
You know, everyone says neurosurgery is quite a stressful field to be in, and it's understandable, but don't you think that the CAT scan and the microscope has really helped to alleviate a lot of the stress that we endure in taking care of patients?
Well, I think so. I think the CT scan and the microscope have allowed us to do things in a much more effective and precise way than we were able to do them before, and subjecting the patient to much less hazardous and invasive diagnostic studies and operative procedures that carried much more hazard than they do today when we're working with the aid of the microscope.
I know you've met a lot of folks over the years, neurosurgeons, that have been of significance to our field. Anyone that you can think of that you'd like, that is now gone, that you might like to reflect here at this time, so that we who will be here further to recall this opportunity to know a little few stories about some of the great men that you've known?
Well, it was my pleasure to know, at least to meet several of the pioneers in neurosurgery and get to know a few on a more intimate basis. When I determined I was going to go into neurosurgery, I went on a visit to some centers for interview and to determine where I'd like to train. I visited with Dr. Walter Dandy, who was a delightful individual and a very colorful personality. Then I went on to Boston, visited with Dr. Mixter, who was just a charming gentleman, one of the finest people I think I've ever known, and Dr. Horrocks and Dr. Poppin at the Leahy Clinic, also superb individuals. And it was my pleasure later on to know Dr. Adson, Dr. Pete, Dr. Sachs, and of course Dr. Sims, who is just truly remarkable in all ways. I would say that of all the senior neurosurgeons I've known, I was most impressed by Dr. Sims. He's such a gentleman and such a guiding influence to neurosurgeons starting into practice at that time. I think he did more for more young neurosurgeons than anyone has done in the field of neurosurgery in this country.
Well, you certainly, in my estimation, have epitomized what Dr. Sims has represented to you, that as a Southern gentleman, because certainly you have meant that to us that have known you well, and those of us who have had the opportunity to be with you. Well, it's been a pleasure being with you, Dr. Galbraith, and I appreciate the opportunity, and I know those who will be viewing these tapes over the years to come will appreciate this opportunity to get to visit with you and learn a little bit about your time spent in neurosurgery. And we want to be appreciative for what you've done for us, not only here in Los Angeles for this particular occasion, but the road that you've paved for us who are going to follow in neurosurgery.
Well, thank you, Phil. I can only say that I think I've been extremely fortunate to be able to do something for the past 40 years that I would not change in any way. If I had it all to do over again, I'd do it exactly the same way. And I can only wish for you and the other young people coming on in neurosurgery the same happiness and pleasure in this field of work.
Thank you very much. Thank you.